this is Betsy Bates with Global Medical News Network here at the annual meeting of the Society of Adolescent Medicine, where the topic has been teens and technology.
Speakers at the meeting discussed new research about today's e-teen, who spends an average of 6 hours a day exposed to electronic media that now goes far beyond TV to include instant messaging, texting, video sharing, and exchanging information on social networking sites such as Facebook. Email, it seems, is passé for teens, who consider it an old-fashioned way to communicate with adults and institutions. I spoke to Dr. Kaveri Subrahmanyam, the Associate Director of the Children's Digital Media Center at California State University in Los Angeles, to see what kinds of new media are most appealing to today's adolescents.
The main tools seem to be cell phones and texting, as well as social networking sites. In fact, they spend as much time texting today as stalking. And social networking sites also have become very popular. So these are the two main tools. I think instant messaging is a little less popular today than it was a couple years ago.
Being in touch electronically plays into many developmental tasks of adolescents, putting them into instant contact with peers in their social networks, and allowing for self-expression, identity exploration, and independence. But Dr. Subrahmanyam says most teens stay true to themselves and their values, even when they're online.
For the most part, we're actually finding that teens don't do a whole load of pretending online, and much of what goes on online does seem to be connected to their offline lives. So kids who are being bullied offline also, we do see the same kind of bullying behavior online. So we're not finding that, for instance, in bullying, there was in one study no evidence that victims of offline bullying were going online to go and bully their bullies. So we don't really find that kind of transference behavior, if you will, in online context.
In most cases, experts believe that e-communication is a healthy means of expression for adolescents once they have been educated about the risks inherent in the new media. Still, there are some signs of danger parents, teachers, and physicians should be aware of.
I think they should really start worrying when they see a tremendous amount of disconnect between the teens' offline and online activities. So for instance, if most of the time is being spent online and most of that time is spent interacting with people who have no role, who have no presence in their offline lives, then I would say that should be a big red flag for parents as well as teachers and other healthcare providers.
This is Betsy Bates for Global Medical News Network.